Hi, I'm Shantanu Nundy. I'm a primary care doctor and a researcher at the University of Chicago. Every day in my clinic, I see patients with chronic illnesses who don't have their chronic diseases controlled. We know nationally that over half of patients with a chronic disease, like high blood pressure, diabetes, COPD, don't have their diseases controlled. And it's frustrating as a primary care doctor. I see these folks in clinic. We do the best education that we can, work with them on coming up with a plan that we agree on together. But frankly, once they leave the clinic, I really have little insight into how they're doing. And lo and behold, 3 months later, they come back, and oftentimes things haven't really improved. They still aren't taking their medicines, still aren't making the lifestyle changes that they need to make. And a big part of the problem is that there's really no way for me right now to support patients while they're at home. All of healthcare is built around the clinic or the hospital, and I have really little mechanisms to support patients while they're at home. And it's at home, and what they do at home is that really matters in terms of their chronic disease care.
This is an overview of the CareSmarts platform. Here we have where the care manager would log in, and once they do so, they would see a list of all their patients. Here's a simulated patient that we created for this demo. In that dashboard, you can see all types of information about the patient. In this case, we're going to focus on scheduled messages that will be sent out. The first one is for the patient to check their blood sugar. And when that happens on the patient's cell phone, they get this text messages telling them to do so. And then the patient will go and respond with their blood sugar level. And then that automatically goes back to the dashboard, and we see here in the dashboard that they've responded with a 300 blood sugar level. And then the care manager will also, when they're on their home screen, you'll see that an alert has popped up indicating that patient John Doe has high blood sugar, and then the care manager would go in, read that message, and then can make a variety of different notes. In this case, the care manager is going to email the doctor and indicate that the patient has an appointment to see their primary care doctor. So that's an overview of the CareSmarts platform.
Hi, my name is Rabia Razi. I'm a physician at University of Chicago Medical Center. I had the opportunity to take part in a pilot study using this text messaging system. We take care of a fairly complex population in an urban neighborhood on the south side of Chicago, and we had the chance to enroll 15 patients with decompensated heart failure when they were admitted to our hospital. For 1 month after discharge, they received messages regarding their medicines, about follow-up appointments, and symptom monitoring for their disease. And we actually showed that patients really were satisfied with this intervention, and preliminary data suggests that there was some improvement in terms of heart failure management as well. This intervention is great because not only does it allow us to intervene on patients who have a fairly complex disease, but also it allows us to fully take advantage of a system which is already in place, such as cell phones, which we found that many of our patients already had.
With CareSmarts, we've created a platform to directly engage the patient while at the same time allowing providers to detect when a patient's not doing well and to intervene in a coordinated way such that the whole team knows what the problem was, what's going to be done about it, who's going to do it, and when it's going to be done. Now we see our participation in the New York Digital Health Accelerator as one to gain not only mentorship in how to grow our company in this competitive and complex environment, but also to get feedback on our ideas of how to do this in a large health system, as well as to test out our ideas further.